Yep, we can start.
So, good morning and welcome to today's presentation in the series of my talk on clinical research. Last week, I discussed actually the part one of clinical research, where two or three things is actually designing and how to go about the planning of the initial part of clinical research I presented in part one. Today, I'm going to actually discuss the clinical research planning part two. It is slightly lengthy actually session, so I request you to kindly concentrate properly and try to understand what I want to do.
Sir, we are not able to hear
Sir, we are
anything,
not able
sir.
to hear anything, sir.
Sir, we are not able to
Sir,
hear
we are not
anything.
able to hear anything.
Hello?
Now we are able
Yeah,
to hear
now
you.
we are able to hear you, sir.
You are hearing?
No, sir.
No,
This
sir.
video we are not able
This
to hear
video we are
anything,
not
sir.
able to hear anything, sir.
Is not
No, sir.
audible?
No, sir.
Okay, I'll go ahead further
Yes.
then.
Yes.
Sir is going directly live.
So my presentation outline will be like this. I'll first tell about the step in the research planning. The second part of my talk today will be the study design. Then I will talk about the population and sampling. This is very important, how you identify a population, and from population how actually you go for sampling. That will be the third part I am covering. Then I will be going to discuss in much more detail about the collection of the data, which is very important part of clinical research. Coming to the work plan, I will mention that once you have decided clinical research, everything is ready, how you plan your entire work of clinical research. Then I will tell about the data management, which is a very important component of clinical research. Then finally, when everything is done, the most important thing is the properly and correctly interpretation of the result. That will be the seventh and the last part of any clinical research is actually report making. So these are the steps and other things which actually I am going to cover. Most probably I will not be able to cover in detail about reporting because itself is a very big chapter and I will take some time later on. Coming to this actually slide, I showed last time also, but because this is very important that what are the steps which are involved in the scientific research, somebody has to understand. I just want to repeat for the people, those who have actually missed previous. So this is a very, very important step which covers each and every part of actually scientific research doing. Now let us start. Actually, we start with actually selection of the area which I want to work. After that, I select a topic. Once I have selected a particular area, whatever may be the area of your subject, you go for a particular topic of that subject. Then what you do that you develop a very crude research question, not a defined one, general question that okay, I would like to do such and such thing. Once you have a crude research question, the most important thing immediately go into literature review and do a very detailed literature review to check whether such work has already been done or not. Suppose you find a answer. You wanted to do XYZ study in a particular disease and you already find that already it has been done and published, then there is no point in doing that study. What you have to do now that you go back and again see that how you have to modify. Suppose you are lucky in literature review, there is no answer. That means what you want to do, nobody has done. Then what you do, that you come back and after the good question, you refine your research question. After refining your research question, again you look into literature review and see that whether this particular refined research question is okay to go ahead or not. Then you develop your research hypothesis based on this research question. Identify all the goals of the study which you want to do. What are the various objectives of your study? That actually you should note down. So research hypothesis, goal and object you prepare. And after preparing that, actually you also prepare your research design. So you have got goal, you have got objective, you have got research design. All these things are required to prepare a what is known as a protocol document. And there is a specific requirement for all ethics committee that protocol has to be submitted for approval. So all the document which is required, that case record form, protocol, and all other information you submit to this committee and get your written approval. Once you got your written approval, then next thing comes actually you have to identify your population. Actually, the particular type of disease you want to study, so many people will be there. All of them, maybe thousands number in a population. You cannot. So you have to actually select. So after your research design, approval of ethics committee, you have to see which is the population you want to actually take for your clinical research, and from there how you are going to go for a sampling. Now let's see how you go further. Now once actually you have got research design, you get a variable. This variable depends on the type of study which you want to do. For example, you want to do hypertension, naturally the variable will be the blood pressure and heart rate and other things. So there will be variable. These variables will be affected by so many confounding factors. So you have to identify your various confounding factors and also find out your bias. And once actually you identify your confounding factor and bias, then you actually develop your research tool. After developing research tool, always do a very small pilot study to identify the feasibility of the study, whether you can do that or not, or there will some issues come. Once the pilot study says yes, it is quite okay, there is no problem, then you plan your main work plan and main study to conduct. Then collect all the necessary data which is required for your clinical research based on your research design, your goal and objective. Once actually your data collection is over, you have completed that, then actually you go for data management. You can do yourself, or actually you can engage somebody who is actually doing a data management. Once the data management is over, the next is very important is interpretation of the data, and then the final is actually the reporting what you are going to do, and then actually you achieve here. So these are very important scientific research which is you have to remember. Now let us coming to first the study design. When you are coming to study design, it is two type. One actually is the descriptive design and other is analytical design. Now let us see first. Actually, the descriptive design. In case of descriptive design, you have got case report, you have got the case series, you have got the cross-sectional study, you have got ecological studies. Coming to analytical, then you have got observational study. Again, this observational study will be either a case control study or it is a cohort study. Coming to cohort study, again it is further divided either a prospect, that means you are just starting study itself first time, nobody had done. Or it can be a retrospective study where already some data is available, you are taking it and you are doing. This is actually also known as historical type of study. Now, the second part of the analytical study is what is known as experimental study, which normally we do. The experimental study will be the randomized control clinical trial, which normally we do phase 2 and phase 3 clinical trial. So phase 2 and phase 3 clinical trial usually comes under randomized control clinical trial. Then sometime actually we do the field trial, especially in case of vaccine or if you are doing some preventive trial. In that condition actually you do randomized controlled field trial in an entire field where large population is involved. And then the third type of experimental study is a non-randomized experiment where we don't do any randomization and do. So these are actually the main type of study design, descriptive and analytical. Now, it's very important thing that you should very clearly understand and select the best study design. When actually you are looking into your protocol, you can find out that it can be done by various methods. But one should be very careful and at least should know that what are the factors, what are the influence, and what are the way actually I could do there, I can get the best study design. Now let us see the factors which will help us in doing a best research design. Actually, that first is the purpose of a study. So based on the purpose of a study, you have to think of a particular design. Second one is that state of exact knowledge. Once you do actually the review of literature, you will find out that what type of work people have done, and based on that knowledge, you have to design which will be the best one for you related to your study question. So this is actually the second factor. The third factor is very important, is variable. Depending on the type of variable which you want to collect, a primary variable and secondary variable, you should be very careful that you have to design in such a manner that the variation in your data collection should not come. So the third important factor which will help you in the best study design is characterization of study variable. And the next one is the latency. What is latency? Latency is nothing but the total duration of a particular study which is required. You know that there are some study which can be completed in 6 months, some study can be completed in 1 year, some study may be taking 4 to 5 years. So depending on the total duration of the study also, it will be very important. If your study is going for very long time, you should be very careful in designing the best study. In the next slide, I will also give you the example how actually the latency affects the clinical trial design. And the last one, which is very important, that you must check, suppose you have made a particular design, that design is feasible or not. So feasibility, selection and feasibility criteria is also one of the very important thing for selecting a best study design. You may be selecting a very good design, but you will find that it is not feasible to get this type of patient, or the patient will not come for particular follow-up. So feasibility also should be checked. That's the reason I was telling that a pilot study is very, very necessary to see that your particular design is feasible or not. So these are the five factors which you have to keep in your mind to design a best clinical research. The next is that actually what is the purpose and what are the various types of studies which is available today to do a clinical trial. One, actually the study based on the etiology. Actually, why particular type of disease is there. So study of etiology is actually one type which you start. It can be ecological etiology, which is not related to particular factor or virus or something. It is just ecological. For example, we have got lot of air pollution, or the water is containing lot of silica. So silica water people are consuming, and then they are developing a bone deformity. So actually study is only etiological because of ecological factor in the nature may be responsible for a particular problem. Then there is a cross-sectional where a group of people are involved simultaneously and you are actually looking for that. Then a case control study. You have got only one case or two cases which are admitted in the hospital, or they have come to you and you have identified. This is very common type of study where people are submitting the adverse drug reaction produced by a particular drug. That is actually the case control study. Next is the cohort, where actually you have got the group of people into group 1, group 2, and then you do the study. That is actually the cohort study. Then the most common which actually we are doing is the interventional study, where you have got some intervention in the form of drug or in the form of procedure or in the form of surgery, where actually when patient comes, you do that particular surgery or you do that intervention in the form of drug and you do the study. This is most common what actually we consider in phase 2 and phase 3 during drug development. Then the second thing is that the study of the therapy. A particular therapy is there, we want to see the study of that therapy as a part of my clinical research. For example, a lab experiment. You are conducting a particular lab experiment and identifying actually what is going to happen with that. Very good example is when you want to evaluate a drug which is actually decreasing the cholesterol. It is a lab experiment. You give your drug, you collect the blood sample, and then you do the all actually the cholesterol level. This is a simple lab experiment. Then normally what we are doing is a clinical trial where you take the patient and you admit the patient into your trial and you give the drug and you conduct the study, which is commonly done by the pharma industry. Then there is a community intervention. I gave an example that there is some problem existing in the community. Very good example is silicosis. Because of excessive amount of silica into the actually water in some of the actually district like Nalgonda district in Telangana, the water contains lot of silica. People are taking that water, so silicosis develop. Silica actually interfere with the collection of calcium in the bone and then they develop silicosis. I want to do the intervention. So I know that this is because of taking a water which is containing silica. I will do a intervention study where I'll take a population, I will give a drinking water which is not containing silica and I will see the effect. Or I will do the community intervention by actually using a particular type of preventive measure. So that comes under actually a completely community intervention where entire community is utilized as a participant in clinical research. Now, Another very important thing is that what actually is the state of existing knowledge. You have got a study question. That study question depends on your clinical trial, on which area you are working. So you should have a very good existing knowledge. That's the reason that literature survey and review of literature and continuous reading is very, very important to see that what is actually is a particular thing related to your study question. How we go, that it may be purely a new idea. When it is a purely a new idea, then actually the type of question and knowledge you have to look of ecological or cross-sectional. Second thing is that purely it is new hypothesis. First time actually you are thinking that if I do particular type of intervention in a particular disease, there will be improvement there. If this type of actually study you are planning, one of the very good thing is that a cross-sectional study. Today, we want to see the intervention of X or Y drug in COVID. Now, all over the country, the COVID patients are there. That particular intervention, I want to apply and that, and then I do a cross-sectional study. Suppose the study hypothesis is where actually I have got very small number of patients required and it's a very, very new drug. I don't have more amount of drug, then I will do just a case control study. I take only few cases and give my drug and then I will check. That actually comes under the case control study. The third is that absolutely new claim association. Whenever actually your claim is first time, you are telling that this is the first time I am actually hypothesized, this is going to happen. In that condition, you do a case control study replication, confirm that, or you can have a stronger evidence towards your causation. So whatever actually is the cause of the disease, you have to do a cohort study. So new idea, you have to do this study, new hypothesis this, and if it is a new claim, this type of study that, and that's the reason that you should have a very good existing knowledge as per based on your question where actually it is fitting in. Then last, the conformational association. Already that particular type of information like in vitro, in vivo data is available where a particular drug has already been shown that it is showing effect. You have to do a experiment or intervention. What is now we are talking a clinical trial or clinical research. I know that a particular drug is very, very useful in the treatment of COVID. I do the intervention and I do the confirmation of my association in the form of clinical trial to prove the causation. Now, I told you that one of the very important factor in clinical research design is the variable. You must know very, very detail about the variable which are very important for you to collect in your clinical research. Normally, these variables we divide into two types that may be a primary or secondary variable. So you must very clearly know about the variable. For example, if actually the variable is a very rare exposure, hardly few people may be actually developing a particular problem. In that condition, actually case control design is not suitable. You will not get so many cases to check the exposure because it is very, very rare. It will be very difficult to do. Secondly, if you want to do rare disease exposure, you need a large number of patients. It is very difficult. It will take very long time. So designing this type of case control study for very rare exposure disease is not advisable. Then very rare disease. Again here the cohort design is not suitable. You need a very large number of patients and we are not sure about the outcome. So very rare disease also you should be very careful in your designing and you must know correct variable. Coming to
Sorry,
acute disease,
Sollu
acute disease is lasting for very short time, like a drug which is there, but what you have present, the disease is lasting only for 4 days or 5 days. In that condition, actually one cannot do the prevalence study. I cannot study the prevalence of prevalence study of a disease which is lasting only for 2 or 3 days. Suppose I do the survey in community, I may not get enough number of patients. So if I design a prevalence study where the disease is acute and very short lasting, it is a wrong way of doing this
ఇట్స్ నాట్ ఎ
study.
రైట్ లీడర్ వాళ్ళకి
Risk
అర్థమయ్యేలాగా
exposure. There are many actually clinical trial
అమౌంట్ ఆఫ్
where the variable is having a
లాస్ట్ టైం
significant
కూడా అంతే
risk
ఫీజు పడిన వాళ్ళు
exposure. Here I will give you example a new anti-cancer drug where the data of safety is not available to me. In that condition, doing a full-fledged clinical trial is usually unethical. Here, I have to be very careful. I have to take only few patients and check whether my drug is safe or not. So whenever there is a risky exposure with any drug which is highly toxic or can cause lot of damage, doing complete clinical trial is not ethical. You have to do very short quality study and then only you have to go. The next is that actually you don't have any data available. Even actually case record study is not possible. You take a particular disease you want to study, the data is not available. In that point of time, if you want to do the record-based study from the hospital, you may not able to complete. So you have to remember that depending on the study variable, actually the type of the clinical research also will differ. Now I told you about the latency, that the duration of the study which is going to last. Suppose the latency of a particular disease developing slowly and it is taking very long time to develop a full disease. It is very difficult to the study and you should be very careful in that situation. For a disease which is very long latency, taking very long time to develop completely full thing,
starting the drug
cost
with
of
adverse
actually concurrent cohort study or clinical trial will be prohibited. It will take very long time. You need lot of money because it will be lasting for 3 years, 4 years. You have to do so many investigation. The participant has to come to you regularly. So it will be very expensive. So if it is a disease which you are going to study for very long time, you should be very careful as far funding is concerned. Here I would like to give two very classical example where the disease is lasting for very long time and how it happened. One example is actually Alzheimer's disease. In case of Alzheimer's disease, actually patient start with very small actually memory loss, which may be lasting for 1 or 2 years. They may not be identifying that they are developing Alzheimer's disease. Slowly, actually, the memory loss will go on increase. After 4 or 5 years, actually they will become a classical patient of Alzheimer's disease. Now they don't remember anybody. They even don't remember their name. It takes very long time. Suppose I want to do a study in Alzheimer's disease, I should be ready that the patient will be available to me for 4 to 5 years. I have to give a drug and lot of money will be involved. Another very classical example of a disease which is long lasting is rheumatoid arthritis. It takes a very long time. Initially, what happens that actually the patient develops a typical swelling onto interphalangeal joints onto the finger. This is there. He thinks that okay, there is something that he will never thought that he is developing rheumatoid arthritis. Slowly, actually, this will increase after 6 months or something, and then after 1 year, he will develop a deformity. When the treatment is going on and if it's not properly treated, after 3 years, 4 years, he will develop a very classical type of deformity. This is rheumatoid arthritis deformity. It takes initiation like that and it will continue for 3 to 4 years. Very long disease. And whenever you are doing a study in a long disease, there is another very, very important issue comes. That is actually the drug which you are using. What about the safety? Because if disease is lasting for very long time, whatever drug you are using, you have to use for a very long time, maybe for 2 years, maybe for 3 years. Then the issue comes of the safety and side effect. Now again, I will give the example of rheumatoid arthritis. In case of rheumatoid arthritis, one of the drugs which we use is hydroxychloroquine or chloroquine. This has to be used for 1 year, 2 years, 3 years, not actually like COVID where you use only for 15 days. If you want to use hydroxychloroquine or chloroquine for the treatment of rheumatoid arthritis, you have to use for 2 years, 3 years. Now problem is that hydroxychloroquine or chloroquine, they produce a very typical side effect. They affect actually retina of an individual. So one should be very careful that whenever you are using hydroxychloroquine in rheumatoid arthritis, regularly you have to monitor the eye and send your patient to the eye specialist to check the retina every second or every third month. So retinal examination has to be continued whenever you are using. So one actually the disease is lasting for a very long time. The drug which you are using is producing lot of side effects. You have to monitor. Otherwise, patient will become blind. He may be cured of rheumatoid arthritis, but he is not able to see because you have already caused the retinal damage because of using hydroxychloroquine. So latency becomes a very important factor in actually a clinical research. Now we go for another very important thing is that actually how you look for a disease population as per your indication, and from disease population how you go for your study population. Now, the population and sampling is actually one of the very, very important activity in any clinical research. If you are not doing this properly, that means if you are not properly selecting your population for particular disease and correctly taking sample, whatever data you are generating will not be there. So this is a very important step to understand. The sampling process is the selection of number of study participants from a defined study population. I have got a defined study population. I want to do a study in a particular disease. I have got thousands of patients. Those are available to me for a particular disease. Now, very important thing that all of them I cannot take into my trial. I have to select only few as a study population based on my inclusion criteria and exclusion criteria, and then actually I will take from disease population my study population. This is my study population. Those who are actually based four groups depending on the type of drug I am using, and all are selected based on my inclusion and exclusion criteria, age, or different type of diagnostic thing which I have done. So disease population to the study population is very important way in study of clinical research. Now coming to the process of sampling, how actually it is involved, how you do actually sampling of an individual into clinical trial. First, actually, the most important that you have to correctly identify the study population. You want to do the study in a particular disease, you should know actually where actually you can get this particular type of population to come to your study. Second thing is that determination of the sample. Who are the people who can actually come into your study? That is actually setting things. So identification of your study population, then determination of the sample population. The third thing is that you have to clearly define the sample participant. Which patient you want to include into your clinical trial. This is the third step in the sampling of the participant in a clinical trial. The fourth one is that the choice of sample method. You want to do random sample or what type of sampling you want to do. You want to do the initial screening. For example, here choice of sampling method, they are using screening. So many people are waiting and they are doing some test to find out whether this particular people, those who are coming for a clinical trial, whether they are fulfilling their criteria or not. So choice of sampling method also depends on the screening method, what actually you want to do for inclusion and exclusion criteria. And the last one, which is very important, is that estimation of sample size. How many patients you want to take into study in each group? There is nothing like magic number. You have to clearly know that the total number of patients required for my trial will be this much. How many have to complete, how many dropout will be there, what is the correct sample size, what statistics you are going to apply. And the best thing for doing that, either you learn biostatistics or just engage a biostatistician to tell you what is the sample size required for each group. So these are actually the five things which are very important for you to select a correct sample for your clinical trial. Now coming to the identification of the study population. Everything I have done, this is my inclusion criteria, this is my exclusion criteria, everything is. Now I have to identify my population which I want to include in my clinical research. The study target population is one which actually results from study will be generalized. Why? Because your study population should be very specific and they should be targeted population. Because the complete population which is there on particular country we cannot test. We take only target population, we do the study and then that we find out whether this intervention is okay or not and then we do generalization. So the target population collection is very, very important. Then only you can actually analyze your data for all the public and actually regulators will allow you to market the particular drug into the market where large number of people are going to use. So generalization will be required. It will be only possible if the study population is taken properly. Second, it is very, very crucial that the study population should be very clearly defined because of this, since it is the most important determination of the sample population. If sample population is wrong, data cannot be generalized and you cannot have a permission for marketing of your drug. So clearly defining your sample is very, very crucial in any clinical research. Now, actually definition of sample participant, how you go. I'm just giving an example where actually you are planning a study, you want to do a sampling of the participant into that study, how you go about. I have taken an example here. I want to do a study where I have developed a very new non-steroidal anti-inflammatory drug, which is very, very effective and it is very safe and it is better as compared to existing non-steroidal anti-inflammatory COX-1 and COX-2 inhibitor. And I want to study the most common indication for NSAIDs is the osteoarthritis. So this is actually my example of the study or the topic or object or goal to test new non-steroidal anti-inflammatory drug in osteoarthritis. Now how I will go? The first and foremost about osteoarthritis, I will read and I will try to understand actually when I can tell this is osteoarthritis, what are the criteria? I must know inclusion criteria. And knowing inclusion criteria, the best source for me is the American Association of the Arthritis. They have given a clear, actually, clinical presentation of OA. When you can say OA, there must be knee pain, and any three of the following. One, the person should be more than 50 years of age. There should be morning stiffness of 30 minutes. There should be crispness. That means there is a sound when actually joint movement is there. When actually you are moving the knee joint, you can listen some sound. There is a bony tenderness. If you press onto the knee, the person will tell I am getting pain. There may be bony enlargement. And some there may be no palpable warmth on the synovial thing. So this actually becomes my inclusion criteria for OA for my new drug. So this is not sufficient because my new drug I am using first time, I don't know the safety. So only taking inclusion criteria is not good for me. I should also know that whether there is some exclusion criteria. So where inclusion criteria is there, now I am checking patient has come to clinic. Yes, there is a swelling in the knee. Most important diagnostic factor for inclusion criteria I told is the X-ray. This is the normal X-ray where there is a normal joint, the articular cartilage is normal and this is normal. When I take the X-ray of a patient who is suffering with osteoarthritis, I get a typical, there is a cartilage loss, there is a bony spur, there is a joint space is narrow. So this is diagnostic. Once I do X-ray becomes a very important investigation for me to include into the clinical trial. So all my patients, those are having this, will be included into trial along with the swelling and other criteria which I have already told that there should be more than 50 years, there should be morning stiffness of thing. But this is a clinically very important. Not only that, I have got that I can also do the staging of osteoarthritis. When I'm studying new non-steroidal, all these things I have to do in an inclusion criteria, take X-ray, get a diagnosis. Suppose the patient should be mild and moderate, then clearly I can find out that the staging also will come. I cannot take this patient, I cannot take this patient, this is doubtful. Only patient with mild and moderate, because that is my inclusion criteria I am going to take. This is the way actually I will include the patient. Now coming to exclusion criteria. By my medical knowledge or by my pharmacology, I know that non-steroidal anti-inflammatory drugs, they cause significant gastric irritation. So they are contraindicated in peptic ulcer or any duodenal ulcer or this thing. So this becomes one of the very important exclusion criteria. Any patient who is actually giving history of peptic ulcer or gastritis, I have to mention I will not include into the trial. The second thing which actually I'm actually going to take into the other thing which actually I'm looking for that is that the second thing which is that there is a renal problem in the patient. Sorry. Second thing I just wanted to tell about actually the issue related to the non-steroidal anti-inflammatory drug also actually cause the renal problem. So if there is a kidney disease, again it becomes the exclusion criteria. So for my study inclusion criteria I have mentioned, I have exclusion criteria. I cannot take patient with peptic ulcer or kidney disease where actually renal function is abnormal. Creatinine and urea is very high. So these become my exclusion criteria. So this way actually I design my clinical trial with new non-steroidal anti-inflammatory drug for osteoarthritis. Now choice of sampling method. There are various way actually you can do the sampling. Now, what are the various sampling methods which are there? One actually the non-probability sampling method. Other is a probability sampling method. Now let us see what is non-probability and what is probability. Coming to non-probability sampling method, actually the type of non-probability includes a convincing sample. Here I don't have any criteria. In my clinic, many people are coming. If convenient, I will ask that individual whether you want to participate and I will take. I'm not having any specific probability sampling. Quota sampling. Few people are available to me in my colony or my area. I will tell I want to do this study and they will come and then there's a quota, I will do the study. But always remember that this convince when people are just coming or have got the quota, it is not recommended for medical research. Really, if you want to do a good medical research, which should be useful for the public and all those things, better never use non-probability sample. Casually for your thesis or dissertation, it is okay. It is for the most biased sampling process and there is no randomization. So better not use a non-probability sampling method in a clinical trial. The best one is to go for probability sample because there is a very good randomization. And what is the type? There is a simple randomization of sampling. There can be systemic randomization sample. You are having a system, by that system actually you are doing the randomization, or you have got stratified randomized sample, or you have got multi-stage random sampling, or you have got sampling, or you have got what is known as a multi-phase sampling. So the sampling in a probability system are of 6 types. One after the other, I will explain that what is simple randomization to multiple randomization, because this is very important step in clinical research. Coming to simple randomization. In case of simple randomization, all participants or element have a equal probability being selected. There are two major ways to conduct a randomization type. Suppose I want to do a simple randomization study, I have got two major ways to do. One, what is known as, I have got random number table. Tables are available. From there I made a random number and I do the simple randomization. This is one method, but this is old one. Today what we do, we have got a very good computerized randomization table. You go to the computer program, enter your information, how many group you want, how many number of sample you want, and it generates a very good random sample and you can print it out. So simple randomization can be done by using the number table, or now today you are using a computer method. Second is the systematic randomization. In case of systematic randomization, actually you conduct the randomized selection of first case on the list of population and then you proceed to nth one until your sample is selected. This is particularly required when actually your population is very long. Suppose list is very long, you want to do 200, 300 cases, then this systematic randomization is there. One after the other you select. One of the very good example people are using, actually they use what is known as our phone book, from where you get a phone number. You open the phone book and see the 17th person. After 17, then you go to the 50th one and give the number. This is actually drug A, this is drug B. Again you go to, again add 17 and go to that and you calculate. Like that actually you can use the phone book to divide your into that. This patient will go to group A, this patient will go to group B. This is actually a systemic randomization. This is another method. The third method is stratified randomization. Stratified randomization means in your clinical trial, the different type of people will come. A smoker also will come, non-smoker will come, male will come, female will come, or there may be patient, maybe obese, non-obese will be there. So lot of people having lot of stratification, they may come in your trial. Then you have to do what is known as stratified sample. So in a stratified sample, the sample either proportionately or equal representation of the data should be there. You cannot say that only take, I will few people with smoker I will take, and few and large number of people non-smoker I will take. No. So depending on this data, there should be equal distribution of how it will be there. Example is there that actually you wanted to do the study where you wanted your participation or this data from various states from a country. There is a country, there is a state, and you want to take a population. So you have got the population, you have to take from various states from that country, and would make sure that the sample from each state, whatever state you have selected from that country, actually the people should be available for that. Or you have got the gender. You say that I will use both male and women into the trial. So here is the example. I have selected India as a country, and my state I want to do study where I want to take a population from Uttar Pradesh, and also I want to take a patient from the Telangana. So I have got the people from both the states into participation. I include distribution also. So I have stratified from the country, and like you have smoker, non-smoker, obese, non-obese, below 60, above 60, like stratification of your sample. This is very important. Multi-stage sampling. There are some studies where actually you have to do a multi-stage sample. Actually, I am starting that I have to do a particular study. I have selected the country. You can select any country. For proper explaining, most of us know in that I want to do this study in country India. Then what is the next stage? Is that I have to select. So this country I have selected, two states I have selected, I will do the study in diabetes in Maharashtra, study in Ghana. So I want to do the study about the diabetes in India. I selected Telangana and Maharashtra. That is second stage. The third stage is that I can do the entire Telangana or entire Maharashtra. So I am selecting a. In case of Maharashtra, I have selected Mumbai as actually the district where I will do the study on diabetes. In Telangana, I have taken Rangareddy district. After selecting the district, entire district I cannot do the study because they are very expensive. Then I will go to city. In case of Telangana, I am doing a study in Hyderabad. And then Maharashtra, I am doing this study in Mumbai. So I have selected Hyderabad, I have selected Mumbai. So country is India, state I have selected, district I have selected, city I have selected. Now in Hyderabad, so many diabetic people are there. In Bombay, so many are there. Now as per my inclusion and exclusion criteria, now I need real my sample. And what is that? The household. The people, those who are actually in living in Hyderabad or in Bombay, in that household area, I would like to select. And from that household, actually, finally, I will get a person. Okay, this person is actually suitable. It is fulfilling my criteria, and then he becomes my sample. So the multi-stage sampling is done like that in many of the diseases. Like I example told you that diabetes, like that, a disease which is having high prevalence, this type of multi-stage sampling is done. Now cluster sampling. In case of cluster sampling, what we do, we have a random sampling from this data from the survey member of group. Very good example is that I want to do a study in school children using actually vitamin D or vitamin C in improving their, or using iron for improving anemia in school children. It is a very simple thing. I will go to various schools in the city and then I will do the hemoglobin and iron content, and then randomly I will select based on my actually inclusion criteria. All people, those who are having iron deficiency, I will select and I will give my drug or iron. So cluster sampling is there where I have cluster, either maybe school or it may be a software company where I wanted to take the people, those who are suffering with anxiety, which is very common. So I will go to the various engineering people, I will do diagnosis and take. So this is a cluster sampling. Now this is actually the multi-phase sampling. Multi-phase sampling is done sometime where actually individually there where there are two diseases are there and you want to check the association. Here I am giving a very good example because all of us know, and there is a lot of literature says that the people those actually having diabetes for more than 4 or 5 years of duration, they are more prone for tuberculosis because in diabetes there is increase in glucose level, their resistance is very low. So if you are exposed to a patient who is suffering from tuberculosis, so incidence of tuberculosis in diabetes is very high. So now I have to, when I want to study this, whether this is true or not, and I have got a drug which I want to study in tuberculosis, I have to establish the association between diabetes and tuberculosis. I go for multi-phase sampling. How I do? First, actually, I go to the population in a hospital to find out how many of them are actually suffering with diabetes. So I have got inclusion criteria. I will do blood sugar level. I will do glycosylated hemoglobin. I know that glycosylated hemoglobin more than 7 or the blood sugar level is more than 200, they are diabetic. I do first test. So I will get, okay, these are the people, these are people, those who are diabetes, where actually I got diabetes. Now I wanted to see that how many of them after this sampling is having tuberculosis. Now going for that, I have to do another test. What is the other test? Is that the other test is actually X-ray test. By that, I will be able to diagnose whether the individual is having actually the tuberculosis or not. So, X-ray test I will do, and I get a patient. This is another way. So, I have got diabetes. I have confirmed with one test. Once they are diabetic, I did the second test and find out that yes, there is the tuberculosis, and then it becomes my there is no magic. How many percent should be studied? 100, 400, how much? The sample size depends on following. You should always remember that you must know the factors which actually you want to check. I again give an example that suppose you want to do in hypertension, how much fall in diastolic pressure with your drug you want to know is your effect size. Generally, if you want to test a new drug, there will be fall in more than 10 millimeter of mercury as compared to baseline. That is my guide. I want to study a new life drug. I want how much is fall in the cholesterol. So you have to fix that so much percentage decrease in the cholesterol only I will consider as a effect. In case of diabetes, definite criteria is already there that if your drug is effective, your effect size is that the glycosylated hemoglobin should come down below 6.5. So effect size becomes a very important factor for sample size calculation. Suppose you take large number of population, they take very long time to have that you need a large sample size. So if your effect size is very short, suppose you say that okay, I will check only if the fall is 40 millimeter of mercury, then only I will, then you need a number of patient. What I am going to measure again the sample size. If the measurement has got lot of variability. For example, if you are estimating the glycosylated hemoglobin, in the estimation of glycosylated hemoglobin, it is lot of variation. Then you need large number of sample size. Recording of blood pressure, if there is a lot of variation in recording itself, you need large number of sample size. If there is a lot of variability, large sample. If your measurement is very accurate, you need only few number of patients to include your trial. Level of significance. This is very important. That how much percentage you give a significant. I will give the example in the later slide. Then power of the study. These two are very important for calculation of the sample size, and biostatistician will be asking what sample significant you want and what power you want. For example, coming to effect size, what is the magnitude you want to detect? I already told how much fall in blood sugar, in glycosylated hemoglobin, how much fall in the cholesterol, all these actually your magnitude. Large sample is needed for minute difference. If you are putting your difference very small, naturally you need large number of people and the size will be very high. Variability, actually you want to do variability, deviation is very important. Whenever actually standard deviation of your measurement is very high, when you are measuring 100 and if your standard deviation is very high, naturally you will need large number of patients. Less variation, less standard deviation, you need less number of subjects. Higher standard deviation, higher sample. Now come to the level of significance. When you are coming to level of significance, first is actually probability. For knowing the probability, we have got two very important things, that is the error. One is actually known as alpha error, also it is known as type 1 error. And this type 1 error is actually mentioned as a probability or P. Usually in most of the type 1 error should be less than 5% or it actually P should be less commonly fixed for type error. Then you can actually change the alpha error from actually 0.05 to 0.01, or even you can say I want to do 0.001, you can do. But if you decrease the probability from 0.05 to 0.01 or 0.001, it is very good. You get a very good effect, but sample size will increase. So what you need, most of the time, actually, this is best to use this one. But if your method is sensitive and very good, you can get even 0.01 or 0.001 can be put. But commonly, P is kept at 1 basic. So this is actually your type 1, or that is known as a alpha error. We are going for power. Power, actually, we always mention that with beta error, or also we say that type 2 error. Here actually you put what is the power of your study you wanted to keep it. So always actually power is denoted is 1 minus beta. Suppose actually your beta is 20. So 1 minus beta will be actually this is usually taken as 100, so it will become 80. So consequently the power of study, if it is increased by decreasing the beta error, thus the sample size inversely related to this one. So beta error is usually actually the 80%. So we have got alpha error and we have got beta error. Just for giving you that what is alpha error, I just give one very good example. What is alpha error? Alpha error is there when you are doing a study. Actually, that particular effect is not there, but you are showing that. That is known as a alpha error. Beta error is there actually there effect, but you are missing that effect when you are presenting. Very good example is there is a story of a shepherd boy who actually takes various actually these animals for gazing into the forest. What he used to do, simply he start shouting, tiger has come, tiger has come, and people they run and see, and they see that there is no tiger. So actually, tiger is there, but he is shouting tiger is there, but you are showing tiger is there, tiger is there. This is actually alpha error. But then really tiger comes and he start tiger is there, tiger is there. People are not coming because he is befooling. So when tiger is there and he is shouting, nobody is coming. Type 2 error. So type 1 error is there when actually the effect is not there, but you are showing effect. Type 2 error is there when really effect is there, you are not showing the effect. So this is type 1 and type 2. They say probability and power to fix. I told you that 0.05 is common, 80% is most common. You can increase to 90% or 95%, but the sample size will increase. Now we'll go to next is the collection of data and the research tool, measurement, error, and bias. This is another very important topic of this. Now coming to collection of data, how you do that? The collection of data or variable. Data is nothing but your variable, your cholesterol. All these variables are classified according to their way you collect. Example, it may be a continuous or discrete variable where you have got the figure value like temperature, blood pressure, heart rate. These are continuous variable 1, 2, 3, 4, 5. These are known as a continuous variable. Or there may be ordinate or nominal variable. Here you don't have actually value, but yes, no. So these are two types. Is a continuous variable or it may be ordinate variable. The other type of this thing is that it dependent. The dependent variable is there like blood sugar, or there may be independent variable you don't know. You are doing some actually biomarker for immunological effect which are totally independent. We don't know. But blood sugar in diabetes is a dependent variable. Whenever you do the study in any diabetic patient, whatever may be the effect of drug, you will definitely get the change level. So blood sugar level become a dependent variable, independent where we don't know. You want to see the effect of particular drug on substance, we don't know, so become independent variable. Then relationship with the study. You have to always think that whenever you are taking a particular variable, it has to have a relationship with the study. When you are diabetes, you are doing, you must have variable glycosylated hemoglobin or blood sugar level. If you are not doing that, then it is not related. All confounding factors. For example, you are doing diabetes. Actually, one of the confounding factor is actually diet. The person is actually taking diabetic diet or he is doing exercise. It will become a confounding factor. You are doing a study hypertension. Person may be smoker. He is smoke. It will become your confounding factor. There are so many effect modifiers. then affect your effect. Then intermediate effective. These are actually the type which will influence your data collection on variability.
ಸರ್ ఇప్పుడు
Now coming to the method of data collection, your research tool.
బాగుంటుందిలేపా మీ రెజ్యూమ్లో పెట్టుకోవడానికి బాగుంటుంది.
When collecting data, you should know that how you collect, what you want to do. For example, blood pressure, what you want to do. Suppose you want to evaluate analgesic drug, you have to have visual analog scale. Suppose you are doing a pediatric disease, there are so many scales are there. So the research tool becomes a very important part for collection of data, and you must use a correct research tool, and all the research tool remember that they should be standardized and validated.
సర్టిఫైడ్ కెన్ లర్న్ లేకుంటే ఇట్లా
Use any research tool which is not validated, is not standardized. Now let us see the
నేను రానంటాడు
depends on availability of information. Always research tool you should check whether somebody has used, what is the data has come, is it okay or not.
పైసలు కట్టచ్చు వాడికి వస్తుంది.
Type of data, what type of data you want to collect? Is it objective or subjective? Suppose it is subjective data, naturally research tool will be defect. If it is objective data like the blood pressure or temperature, this is purely objective data, you can record. You can see by your eyes that what is the fall in the temperature, what is the change in the BP. So type of data, again research tool will differ. All subject you will need lot of actually scaling system.
వీళ్ళందరూ
Resource available. You may be trying to use a particular research tool, but it may not be available. So you should be careful that research tool which you are selecting should be available to you during clinical trial. Then the characteristics of the tool also is very, very important. Coming to research tool, most important, using available information, record. Check all the records and technique which people have used. For example, you have to use a study for anxiety, psychosis, or schizophrenia, where you want to use scale, or you wanted to do the study on Alzheimer's disease. There are actually scoring system for evaluation of memory. There may be 1, 2, or 3 types of scale, which is very good, which has given a very data. So see all record, select a correct tool for that. Observation checklist. Always prepare an observation checklist when you are doing a study to detect a particular thing. Most commonly we use a observation checklist to identify a particular type of side effect. For example, I told you if you are working on non-steroidal anti-inflammatory drug, always ask the patient that whether he gets some gastric pain, nausea, vomiting. So you prepare your checklist depending on the type of drug you are using and type of disease you are evaluating. This is the second method. Third is self-administered question. You prepare a questionnaire and then you give to that to participant and let him or her answer it. Interview. This is very commonly done in many of the studies where you want to collect the data, especially epidemiological studies, whether incidence of anxiety is very high or the incidence of migraine is very high or whatever is there, you have to have interview and have a group to do the study. Then measurement. This is most commonly we do lab test or investigation. Most of the study we do the lab test like RT-PCR we do to test the COVID patient. Blood sugar we do for diabetic patient. Lab test to confirm a disease or we do the investigation. You want to diagnose tuberculosis, you take X-ray. You want to diagnose some tumor in case of actually cancer, you do actually CT, MRI or PET scan. So you do the investigation or lab test. So these are actually becomes your research tool for clinical study. Then choosing the format of questionnaire. There is a fixed alternative, yes or no. The individual has to only answer yes or no. This is usually not very reliable and a powerful tool. If there is no alternative, one can use it, but it is not a good actually alternative to use in clinical research. Open-ended. may not be properly answered, may be difficult to score. Suppose you have got a open-ended question to evaluate it. You can use it, but you should remember that probably answer may not be uniform from each participant, and it is very, very difficult to really calculate a correct score. So this is also not very good. But if the alternative is not there, one can use it.
London diesel కావాలంటారు ఇప్పుడు.
Using the format of interview. Interview bias is a serious problem. Unstructured. You are not actually having a very structured interview. It will be very, very biased. One interview, one person is doing a serious problem. Sometimes he is asking something, sometimes he is asking something. Data may not be actually very good to analyze. Lot of variation will come and analysis will not be possible if you are using any unstructured interview. Then sometimes you use a semi-structured, follow question followed, probability test, or you can do a pilot study that is semi-structured. Best is the structured one. You do the structured one, do validation and standardization and check and prepare that structured interview and do that one. This is the best. And always actually it reduces the bias. So always prefer very good interview which is having a total structured standardized and proved for all your clinical study where your variables are subjective. Now, editing question, you always have to remember when actually you are preparing a questionnaire for any study, whether for interview or for actually collecting the data, there is actually magic number of 9. Always avoid these 9 mistakes when actually you are preparing any questionnaire. First is that avoid leading question. Don't prepare any leading question in any questionnaire. Avoid questions that invite this social, any some issues related to social thing. Please don't, because always there will be bias in that. The third thing is that avoid double barrel question. I can answer this, also I can answer this. Both will book okay. So always avoid a question answer where the double barrel. The fourth one is that avoid again I am saying long leading question. Nobody will read. So this question is having 4 or 5 lines, so many things to be understand. Nobody will follow. These are first 4 actually mistake you should avoid. The fifth one is that never use anything which as a negation. Negative actually question should not be put. Always put a positive question. Think positively. Never put any question which is absolutely irrelevant for the study which you are doing. It should be totally relevant and it should be useful for analysis. Next is that avoid poorly worded or lot technical things are there. It will be very difficult for person to give a response.
యావరేజ్ వాచ్ టైం పెరిగింది 10 నిమిషాలకి.
Big word, technical word, people may not understand. Avoid ambiguous words or phrase. Don't use any phrase. These are actually 9 mistakes you should avoid whenever you are actually editing or preparing any question.
ఎందుకు?
Now we'll come to one of the most difficult and one of the most common thing which happen in clinical research is measurement error. And this error actually lead to wrong result of a data. Either drug will be not showing activity in spite of it is very good, I told alpha error, or the effect is there but we are missing, that is beta error. So measurement error is very, very important in any clinical research. What are they? Definition of the error is that a false or mistaken result obtained during study or experiment. So there is a false or mistaken result which you obtain that actually becomes an error. Like type of error is a systemic error, that is biasness. That error having certain magnitude and directly repeated every measurement. For example, very good systemic error, I can tell you that Individual actually is recording blood pressure, but he has not checked the blood pressure instrument. Actually, there is a problem in bias that the BP instrument is not correct. It is giving a false reading. But every time he is using same BP apparatus and recording here, it is a systematic error.
Oh, but still,
Or you are using a particular instrument
hello,
which is
hello,
not
hello.
standardized or something is there you are using, so this will give all every time a systemic error. The other one is that random error. Sometimes it is appearing, sometimes it is not appearing. Here that it is not fixed pattern or magnitude also vary. Today it is very high error. And after 3 days we say that this error is not there. Very good example is that actually I am doing glycosylated hemoglobin in one lab which is not validated. That lab today is actually buying some of the kit from a vendor which is actually selling a very poor cost. He do the test. I know I'm getting a wrong result. Whereas actually the lab which is validated, they're always using one of the best the method to do that, it will not come. So there is a variation in the lab test when they are doing with one kit one time, other kit one time. One technician is doing study on Monday, other technician is doing on Friday. I get a variability. So this is a random error. One day I am getting the good result, other day I am not getting the result. So there is a systematic error which is continuously occurring. Random error is occurring one day or not occurring other day because of reason I told you. Now, what are the source of error? So many errors are there. Now, there are three major sources. The first source is actually the participant. You are telling the participant to do like this, take my drug like this, take along with this thing is there, but he is not following. Very good example I can give here that you are doing a study in peptic ulcer and you are using proton pump inhibitor. We all know that the proton pump inhibitor, they are only effective when they are taken empty stomach, because that proton pump inhibition actually occurs in stomach. At that time the stomach should be empty, then only drug will be effective. You told the participant you have to take this tablet in empty stomach, and after taking tablet up to half an hour please don't take. But this patient is taking your tablet and immediately he is taking breakfast. This error will come, and this participant when he will come to you, there is no improvement in peptic ulcer because actually the drug dosing error is there. Other example, you are using vitamin D in vitamin D deficiency. We know that the fat soluble vitamin D, vitamin K or vitamin A, they are well absorbed when they are given with fat or with milk. You ask the volunteer or patient to take this vitamin D along with milk, but he is taking with water. Vitamin D will not be absorbed and vitamin deficiency will not improve. So this is actually the source of error which is coming because of the participant. He is not using one day drug. He is not using the drug in the morning. He is avoiding, then after 2 days he is again taking two tablets. Like that he is doing. Second is observer error. You are doing mistake in recording some of the parameter and then you are making error. Last, that instrument error. Your instrument itself is wrong. I told you that BP apparatus itself is a wrong reading it is giving, or a ECG machine which is not actually standardized properly. It will always will be giving prolongation of QT interval because instrument itself is wrong. So either there is a participant error, observation error or instrument error. For this reason I told you that in clinical research every instrument which is used must be standardized or validated by the licensed people every 6 months. It is mandatory. Otherwise, that instrument error will come into clinical research. So these are three important source of error. Now we'll come to most important thing is that bias. What is that? One is the design bias. When you are designing a trial, I told you should design the best one. You have a sample bias. you have to recruit 200 patients, but the money is not there, people are not able, you are only doing study on 60 patients. So this is a sample bias. Study bias selection. You have to use patient those having a glycosylated hemoglobin more than 7. You are including one patient who is having actually 6.8. So study selection is bias. Response bias. You want this response should be like this, but you are not bothering about that response and one little bit here, low or high, you are including. So this is the design bias which can occur. What are the other type of bias which is very common is that information bias. This is coming from the observer because all principal investigator they don't do clinical trial and they don't actually do anything with the patient. They just do only the actually the people those who are co-investigators they. So when they do interview, there may be bias in the interview. They you are using a wrong unstructured system or measurement bias. Individual may be recording two times difference or two individuals are recording same thing in a different, that is intra or inter bias, reporting bias, recall bias, or there may be a technical bias. So these are actually comes under the information bias. Few of them we will take. Coming to design bias, I told the selection. Selection bias may be distortion of the estimate effect result from manner which the study population should be selected. This is probably most common type of bias in health research and occur observational or analytical study. So you are actually by selecting the people from the population. I told you that you have a population where so many people are there, but you are not properly fixing your inclusion criteria. For example, in osteoarthritis, you are not properly taking X-ray and you are actually including, or you are doing some health research, then this design bias will come. Prevalence or incidence. You are using a prevalence or incidence. How bias will come? Type 1 bias will come introduced into the case control study result of selection of survival amongst the people. Now, actually, you want to see that in a particular population, because a particular disease, actually how many people are surviving, how many people are actually dying. In 10,000 people, how many people are suffering with a particular disease. This is actually prevalence or incidence. Here actually bias will come. How it will come? That you are selecting a disease which is actually having a type what is known as a disease occurring before much more. Today you are doing a study. Already disease was occurring 2 to 3 years ago. And now today you are dizzy. By that time actually all the mild cases of that particular disease they have already improved. You don't get those people or they are cured. Severe diseases people which were there 2 or 3 years already they are died. Today I'm doing a study with prevalence and incidence. I don't get mild cases, I don't get severe cases, so I will be having lot of bias in this type of study. And admission rate bias, this is another thing. This is very common when actually you are doing a study which is actually related to hospital admission or people those who are coming to your clinic for particular type of study. So there may be difference in the rate of admission and that will bring a bias. For example, you want to do a study where you wanted to have actually admission in the hospital. And this is a hospital-based study. I give an example of I want to do the study of asthma. And I should know that asthma is more common and more number of patients will come to hospital to attend during asthmatic attack only when there is a cold climate or lot of humidity is there in the weather. If I do the asthma study in summer, the number of patients will be coming very less. So this is one. Second thing, I want to do the study in gastroenteritis, people those who are coming in a hospital with complaint of diarrhea, loose motion, this thing is there. This is more common in actually a season where there is a rainy season, lot of contamination of water is there. So if I'm doing a study not in rainy season, selection of the time for a particular disease is not correct. Second thing is that actually disease individual you have taken, but he developed a second disorder. You have started study in Alzheimer's disease, but actually patient has also developed stroke. And because of that stroke and complication, he went to other hospital which is actually treating stroke. So this is another thing that person is not coming back to you because he developed complication of the original or sample disease. So how this problem comes when actually you are using a hospital based admission bias may occur in a clinical trial. Third and very important thing is that you are trying to actually do a study. This study is actually in hypertension, but actually you are working in for the investigation because they are that if they come to your hospital, which is they will develop infection. Very good example that a center which is treating coronavirus and I want to do a study in diabetes mellitus and I'll ask them to come to the center where actually I'm also treating coronavirus, people will not come. So if there is a relative risk, the individual will not come. This is actually another way that admission rate will come down. So people will not come to the place where there is a high risk of developing some complication. Non-response bias. This is very common type of problem that actually we are looking for a particular type of response, but we don't get that thing. Either this bias is actually inherent or it happened artificially due to the procedure. This type of bias is due to refusal of participant. I told you that the non-response is coming that individual is not following your instruction. I gave example, not properly using proton pump inhibitor in a peptic ulcer. So it's a non-response bias. It is not the failure of the drug. Individuals who do not participate like to be different for the participant who is participant. Non-responder must be compared with responder with regard to exposure and outcome variable and order of asset relative degree. Here what happens actually, this non-response bias is not because of poor use of drug by individual. There is an inherent bias. Either there may be some genetic variation or some patient they don't respond to particular drug. If you go back and see into literature that all patients of hypertension they don't respond to beta blocker. Only 60% they respond. 40% of the patients, suppose you have been included into your trial, they are non-responder per se, they will not respond. Similarly, it may be possible that some of the patients, those who are having a particular type of actually genomic marker positive, they don't respond. Again, I will give very good example here of non-responder. In case of breast cancer, you have to do what is known as HER2 positive result. All the breast cancer patients, those are HER2 positive, only respond to drug Herceptin. Patient of breast cancer, those are HER2 negative, they won't respond to Herceptin. So there are inherent bias in an individual. Similarly, bronchial asthma. Many patients in bronchial asthma, because of inherent variation in the type of asthma, they don't respond to beta stimulant. So these type of people are non-responders. You have to differentiate between individual responding and not responding, whether it is because of they are not properly taking drug or something wrong or there is something wrong in their disease or in their body. Drug is not getting properly absorbed from the stomach itself, will not give the result. Then a certain information bias. What is that information bias? Is that distortion? Some particular information is there. Finally, when it is coming, it is totally distorted, and estimated effect is due to the error of the measurement error. I told you that you have never actually checked your BP instrument and you are go on reporting here. That will come. Or you have misclassified the participant. I told you that you have to classify the patient as per your inclusion criteria, exclusion criteria. You have misclassified. I told you that in case of osteoarthritis example which I gave, I only wanted to include the patient with stage 2 and stage 3. I did a X-ray, but I have not bothered to really say stage 2 and stage 3. Patient who has a doubtful, I have taken, or patient stage 4. So because of misclassification, I have taken the patient. So a certain or information bias during the investigation also I have done, and this actually led to all error my study. So this is actually a certain or information bias during the clinical research. Measurement bias, I want to tell you that observer, inter-observer issue. Same individual today, he is taking one reading, he reports one thing, second time he is reporting different. So intra-observer, every time he is telling different result. Inter-observe, one person is giving one data and one technician is giving another data, that is inter-observation. These are actually the variation which comes in the observation, usually very common in case of the lab investigation which is done. Participant, I told you, lot of biological variation in their body. Drug is not absorbed. Some people are fast metabolizer. Some people are slow metabolizer. So when they are fast metabolizer, they will not get the effect. Those who are very slow metabolizer, they will get lot of side effect. Slow acetylation will produce one type of side effect. There are many examples. That is what is known as a pharmacogenomics. This is the reason you get from the participant. Then technical method error variation. Technically itself, the method which you are using for doing a particular test or actually doing particular type of recording itself is wrong, and there is a lot of variation. Standard error is very high in recording particular parameter, so that will give rise to measurement bias. Recall bias. Recall bias is that the error categorization may occur in a information exposure variable unknown or inaccurate. The water information is there actually that is not really properly known or it is accurate. It has been recalled there. We are not sure about that. The recall both from the case or control may differ in both amount and accuracy. And cases are more likely to recall exposure, especially if there has recent media exposure on potential cause of the disease. Here I will give very good example. Many people are reporting very good effect of hydroxychloroquine in actually COVID, till the report start coming that the hydroxychloroquine is not working very well in COVID. When actually it start appearing in media, many of the patients they tell no, we are not getting effect. So if the media telling something, actually the individual actually change his body. That is the recall bias. So the accuracy and the information which is coming is affected because of media, not actually because of some particular thing. Example here is that they have done a study comparing actually in the pregnant women with the number of fetal that, and the information was actually given. Due to that, all the people actually those got a particular type of information they found, actually they ended with normal control, and it was found actually 48% of the farmers who got a wrong information, the number of deaths was very high. So exposure to particular drug was not the effect, but some people were shown that this drug is actually causing high mortality. So the number of deaths was very high, and the people those who are not told where the number is not taken. Now let us fix a collection, data, research tool, measurement, various bias, and now we will go to the last part, what is actually having. So we have already seen data, research, measurement, bias. We will now go to the final part of my presentation, that is the work. It is very important. If you have not planned workily, then the result and the end is wrong. Better planning always gives better result. Mention specific step, what exactly you want to do. Write each and everything very clearly, step by step, what you want to do in your work plan. You write very clearly in method, listing the activity related to the study, how you are going to plan a particular thing, how it will be implemented, how drug will be given, where it will be stored, who will give the drug, when drug will be given, how the result will be collected, how it will going to analyze, who is going to do the analysis of the result. All this should be listed first in the method which you are writing. Second thing is that identification of the responsibility of activity. This is another very important. Every clinical research team actually have so many people. You have got principal investigator, co-investigator, and then you have got people those who are actually doing lab investigation or giving a drug or recording. You have to write each and everybody responsibility and what work they have to do, when to do. Everything should be properly identified and put on a very specific method, written form in the method. Setting a time and date of achievement. If this you are not doing, it will be very difficult to complete the particular study. So timeline for each activity, when actually you are completing the recruitment of all people, when you are going to complete the data, when the data will be measured, when the result will be done, everything should be on timeline and it should be monitored properly. Otherwise, there is no end. You will go on doing the study and it will take 4 years and 5 years. So setting time and date is another very important thing should be mentioned in the method. It's a very specific step. Putting all elements together in a legible form, who could in a chart, part chart. You might have seen the part chart which is done. The patient will be actually included on day one. The first dose will be given after day three. The third dose will be given after 1 week. This investigation will be given on 30th day. What investigation will be given? So there should be a chart available. You should know at what time the participant, when he is coming, what activity is going to do. That should be there, or there should be a table. On day one, what investigation will be done, when you are going to take informed consent, after informed consent, once what time for drug will be given, when the last drug will be given, and when he will going to follow up. All those things are there. I should be in the part chart or it should be in the table form. And the last thing is that whenever actually you are mentioning and work planning, never forget about the amount from where the money will come. Funding agency, are you going to put money from your pocket, or you are asking somebody, or it is a pharma industry or a national agency from the where the funding is coming. So budgeting is very important. So you have to note down each and every point for that, for participant, whether you are giving some money for coming and going, what drug you are giving, how you are preserving, what investigation, how many times you are doing, what is the investigation card. All those things should be must your budget and funding. So these are actually the steps which is required in the work plan. Now we are coming actually, work plan is there, everything is there. Now we have come to real situation, starting a clinical trial. Now when a conducting clinical trial, the first step and the most important step is that informed consent. Always remember that whenever you are doing any study in human subject, it may be observational study, it may be screening study, always take informed consent, and this informed consent must be approved by the institutional ethics committee, or if it necessary, even from the institute and regulatory authority, depending on the regulation of that country, of that institution. So this is the first thing you have to do in any clinical research. Second thing is that there should be clear instruction that what will be done, when will be done, and how it will be done. It is the second in clinical research. Third, each and everybody who is participating in a clinical trial, your nursing staff, your lab investigation, a lab person who is collecting the data, who is actually sending by the courier person, everybody should be briefed properly that what to be done. Even actually the courier boy who is coming, he should clearly know that within how much time the sample which is collected and kept should be sent to the lab. So everybody should be briefed correctly about what they have to do and what is their timeline. So briefing becomes very important. Not only the team people, even actually the participant, they should be briefed perfectly about especially ADR monitoring. And the last is that confidentiality. Only people those by regulatory thing are allowed to look into the data, or the protocol part only should be allowed, because confidentiality is very important, because that is written in informed consent that your data or participant data will not be told, and whenever you are doing publication you are not going to put any, because the informed consent is the only document where the name of the participant is there. So the confidentiality is very important. So these are actually four main things which actually is there in clinical research. Like that, there are so many, but these are the four things one has to remember whenever you are conducting clinical research or clinical trial in a human subject. Then once you have done that data management, it is a very simple thing. Data is there, whole process is dealing with data from every start from the beginning. Today the data has collected, work is started, whether screening is done properly, whether drug is given or not. So from the beginning actually that data management starts. Whereas the data analysis it occurs at the end. So beginning start your data management, and actually happens the analysis when all the data from that participant is collected. We do the analysis, and most of the time we engage a person who do the data management. It can be divided into following: preparation of data entry, case record form. Data entry, you have to identify the people, those who are entering your data, and once the data is entered, then data analysis. So there are three phases: preparation of data entry form, entering the data into case record form, and then doing the data analysis. This is the data management, and data management people will be able to tell us all these aspects, what actually has to be done. And even preparation of the case record form itself is a very big science. It has to be done properly, and each and every data has to be entered very properly. Data management, preparation of data entry. This is very important. So there should be a questionnaire form which is already prepared by the data management people. It is actually having a all actually clinical trial has got their unique ID number. Every clinical trial may be with the same drug, same disease, but they are a different identification number should be unique. there must be a coding, there must be preparation of master sheet manually. Dummy table always should be prepared and entered to check whether it is correct or not. There must be a quality control team. They should come and check whether data is entered properly, whether or not. So the quality control also becomes then data entry. So these are the things actually data management. Then for analysis of your data. This data analysis actually descriptive may be presented in a tabular form, frequency distribution, or this is the first data in a bar chart, pie chart, line chart, or data can be presented, or actually you can have histogram, numerical data. Percentage AB has shown measurement of sender tenses, this thing. So in the form of table or in the form of graph or it is in the form of numerical preparation. Whatever the way the data analysis and presentation can be done. Then coming to the biostatistics, because this is very important final, because that will only tell whether the data which is collected is true or not. And this is pre-decided which statistical method will be used, number of sample, everything should be there. How it will be there? Now this is very easy. The researcher has got principles of biostatistics, hypothesis, detection of the proper statistical depend. What it will depend, the objective, looking for difference, looking for association. Now, very good biostatistical computer methods are there. They will help you in doing biostatistics. Type of data, parametric or non-parametric, you can identify and enter there. Then you can find out your distribution, whether normal, binal or Poisson. All these things of analysis, this is possible by biostatistics analysis, and now we have got a very good and advanced computer designing which can be done, or you can engage a biostatistician to do, and he will give all this data to you for your reporting. Coming to interpretation, which is most important, the discussion of result in a way that relate data obtained to each other, clarified association with other finding. Because interpretation is very important, it is always advisable that all the raw data, everything should be shown to other people. Let them also check and see each and everything and should be clarified properly. And you can go on rechecking. And the final interpretation should be only done, but when everything is properly approved and all calculation and statistics, everything has been checked properly, that actually is the interpretation. And the last one, what actually I am talking is reporting. This is most important because finally the everything which is happened during clinical research, nobody has come and seen. But everybody is having availability of the report, hard copy or soft copy, or in the text form to see. They can see your data, they can see your interpretation, because this is the hard copy that has to be submitted to sponsor or to the regulatory authority for the approval. So reporting becomes very important and it should be done in a very proper manner. Itself is a very, very long topic, and probably I may not